we're going to go ahead and get started. Welcome. Good morning to everyone and welcome. I'm going to introduce the speaker that you're going to be hearing from this morning. This is Kelly Clarkson. Not the singer that you've probably heard about, but I have the privilege of working with Kelly. She is the State Health Insurance Assistance Program Manager for the Upper Cumberland region. She works with volunteers through the SHIP program. We call it SHIP for short, just like the boat, that she will be sharing more information with you about. The SHIP program provides free and non-biased Medicare counseling to beneficiaries, family members, and caregivers. SHIP also provides help with Medicare annual open enrollment, which occurs in the fall of each year, and assists beneficiaries in applying for services to pay for their Medicare Part B premium and help with prescription drug costs. So please join me in welcoming Kelly Clarkson.
First of all, does everybody have a folder? I didn't do a PowerPoint because I wasn't real sure and I'm not technology savvy, so if I was afraid that if something went wrong, I couldn't fix it. But you do have a presentation on the left-hand side, and on the right-hand side just talks a little bit about the SHIP and S&P programs at the office. I think there's also a AAAD brochure in there as well, talking about all of the other programs. So I'm here today talking about the Medicare ABCs. Typically, when I've sort of combined a couple of presentations, one, just a brief presentation for what is Medicare, and combined it with a short version of our Welcome to Medicare class. Typically, we do have, for people that are turning 65, we're going to be going on Medicare for disabilities. We have Welcome to Medicare classes in most of our counties. At least once a quarter, sometime in Cumberland County, we do have them every month. So I've sort of combined the two because most of the time those classes are 2 to 3 hours, and I only have 45 minutes to combine a whole lot of information with what everybody wants to know. I'm pretty informal, so if you have a question, please feel free to ask it at any time. But this is the 50th year of Medicare, so it started in July of 1965. So that it's a big year for CMS, that's the Centers for Medicare and Medicaid Services, and there's a big push to let everybody know that it's the 50th anniversary. Medicare is health insurance for people aging into Medicare, turning 65, for people that are on Social Security disability, or for people that are going into end-stage renal disease. All ages for disability and for end-stage renal disease, they would apply through Social Security, and that is how they would get their disability that way. Like I said, Medicare is run through CMS, Centers for Medicare and Medicaid Services. You can sign up with Social Security or with the railroad retirement benefits, depending on how you are getting or how you pay into the system, either through Social Security or with railroad. There's a picture of a Medicare card, red, white, and blue. Typically, people will keep that card once they age into Medicare forever. So we suggest you put it in a safe place. Keep it with you if you want to, or if you want to make a copy, because that is your Social Security number or your spouse's. Black out most of the portions except the last 4 digits, and with the letter at the end, and keep the effective dates. We suggest you keep the original. If you travel, they might need that. But if you go to the doctor, typically they won't ask for your Medicare card every visit. So treat it like a credit card. Just make sure that you just don't throw it around and misplace. If you do misplace it, you can order another one. But just make sure that people you don't leave it anywhere, because if it does have your Social Security number on it. There are 4 parts to Medicare: Part A, Part B, Part C, and Part D. Part A is your hospitalization, covers inpatient hospital stays, skilled nursing facilities, hospice, and home health care. Part B is the medical portion of Medicare, and typically use that when you go to the doctor's office. If you go to the hospital and it's observation status, that is where the payment will come in. Preventive services. Durable medical equipment is one, people that they always ask, hospital beds, walkers, wheelchairs, and diagnostic tests like CAT scans, MRIs, things like that. Part C is also known as Medicare Advantage plans. Those are HMOs, PPOs. They take you off traditional Medicare and put you on a privatized insurance plan. The one thing to know about that is not all doctors, not all hospitals take on Advantage plans. They are based from county to county. So if you live in Putnam County, you might not have the same plans offered to someone that's in DeKalb County or White County or Cannon County. So you have to call all of your providers, hospitals, if you get durable medical equipment, to see if they take those plans, even skilled nursing care. So if you plan to have a hip replaced and you need to go into skilled nursing for 20 days, you have to make sure that skilled nursing facility takes that Medicare Advantage plan. Part D is prescription drug coverage. That started in January 1st of 2006, I believe. Covers outpatient medications as well as the shingles vaccine. Does not cover over-the-counter medications. Applying for Medicare, you can do online with Social Security. Typically, if you're already receiving railroad retirement benefits or Social Security, you'll get your Medicare card 3 months ahead of time. If you are not receiving those benefits, we suggest, and you need to have your Medicare to start at age 65 because you don't have health, you don't have other insurance, then you need to go to Social Security or call the Railroad Benefit Association or Federation and apply for those to have your Part B and Part A to start when you turn 65. If not, it could be delayed because you're not taking your benefits and Social Security or Railroad does not know that you need those. Not a hard process, but you just want to make sure your benefits start when you need them to start. You can apply 3 months ahead of time as well. Don't have to be retired to do that, but if you are, then that's on you. I will let you know that if you enroll in Part B the month you are 65 or the 3 months after, during your enrollment period, your Part B will be effective at a later date. It'll be delayed a couple of months. Yes.
Only enrolled during the open enrollment or at any time that it's 3 months prior to?
3 months prior to your 65th birthday.
Okay, so then what's the term open enrollment?
Part D prescription drug plans for October 15th through December the 7th.
Okay, thank you.
That's it. Typically, open enrollment or the annual election period is for people that's already on Medicare. And we'll go over that in a few more minutes. Part A is typically free if you have enough Medicare covered working credits. I will let you know only Social Security or the Railroad Retirement can let you know if you have that. I think it is 40 working credits. Most people don't have to pay a Part A premium, but if they do, it could be as high as $407 a month.
People who are on disability and qualify for Medicare, do they still have to have this 40 work thing? Okay.
You have to have, there's other ways to get it like SSI, things like that, but you do have to have enough working credits. You can draw off a spouse. Some people that are on disability might be able to draw their Medicare off a spouse, but typically you do have to have your working credits to be able to do that. We've already talked. Like I said, Social Security will be able to let you know about your Part A. Yes.
Even if you're 65 and you still are working and have insurance through your company, do you still have to file for Medicare just because you're turning 65?
No, your Part A, you'll get a card, and you'll want to tell them that you are still currently working. And I'll go over that in a minute. But you'll still need to. Typically everybody takes their Part A, even if they're still working, because it's free. But you have to let Social Security know that you want to deny Part B, so you can have a special enrollment when your work ends. But you also have to check with your employer to make sure how that insurance works with Medicare. It depends on the amount of employees that they have as well is if you have to take Medicare or not. If you work for the state, and because it has 20 or more employees, you can deny Part B, but if you are working for somebody that only has maybe 5 or 6 employees, your Medicare would be primary, so you would have to take Part B. Like I said, Part A is inpatient hospital stays, semi-private room, meals, all your services and supplies. Also inpatient mental psychiatric care in a hospital. You do have a lifetime limit on those days, and I believe it's 190. It is. Skilled nursing facility. First 20 days are free. After that, you would have a copay. You do have to re-qualify to stay in skilled nursing. You just can't stay for as long as you like. You do, if it's like for a hip replacement or a knee replacement and you need physical therapy, typically that's, like I said, 20 days, and they send you home with home health or outpatient physical therapy. But you do have to qualify for those services to continue if you need to stay in a skilled nursing facility longer than 20 days. Home health care services is under Part A. Occupational therapy, speech therapy, physical therapy. Hospice care has to be an approved hospice facility for hospice provider. And blood. In most cases, if you're inpatient, you don't have to pay for blood, but if you do, then it would be covered under Part A. And this goes back if you're working about enrolling in Part B. If you are not drawing retirement benefits, then, like I said, you'll need to go to Social Security and let them know that you want to deny Part B. If you are, and you're covered under a spouse, or you have other issues, there's a special enrollment for everything. Just know that. There's a 20-page, I have a 20-page folder just of different special enrollment periods. So I'll apologize now, I don't know them all. There's too many to really, I know some of the general ones, but there's a lot that has different things that you can qualify for. But generally, you have a 7-month period to enroll in Part B if you need your Medicare to start 3 months before, the month of, and 3 months after. The general election period, if you didn't take Part B when you needed it, but you are not working and you have no insurance, is from January the 1st through March the 31st. But your Part B does not start until July the 1st. There will be assessed a penalty. It's 10% for every year that you were eligible for Part B, that you didn't take it. Again, Social Security is the one that will tell you what your penalty will be. Now, if you are working, your spouse is working, and your Medicare, you don't need your Medicare to start, your Part B to start, because you're covered under work or union coverage, then you can delay your Part B or you can deny your Part B, and you'll have a special enrollment period when your work-related coverage, insurance coverage ends. You'll have 8 months to pick that up. Yes, ma'am.
On the skilled nursing facility, you said that the first 20 days are free,
Yes.
and then if you go back home, and then you have something else comes up, can you go back in, and is there a total number?
Typically, yes. But you have to have an inpatient hospital stay for 3 days to go into skilled nursing. If you're in a benefit, I think if you're in that 60-day benefit period, you are able to go back in to skilled nursing. I'll have to double check on that. But I do believe you have that benefit period to go back into skilled
I
nursing.
mean, 60 days after you get out.
From the first day your inpatient starts.
Right.
Your inpatient hospital stay is a benefit period. It is 60 days from the first day you go. So I believe you do have that period of time
So
that
if
you can
you
go to
come
skilled.
home for a while, you can still just go back without going back in the hospital.
Most of the time, yes.
Yeah, it's
But
30
again,
it's 30 days from the time you leave the nursing home. You have 30 days to go back in without another hospital stay.
yes, you're right. I was
And
thinking
then
benefit
60
period
days
for,
to
yes, I'm
restart it,
sorry,
yeah.
yes. Skilled nursing is 30, benefit period is 60 without the deductible. I'm
And
sorry.
is there a total maximum days you can be in your lifetime, kind of? you know, if you were sick for many, many years, in and out.
You do have a number of lifetime days for Medicare. I mean, I'll have to, I don't remember, because there, like I said, there's, okay, Part A, 0 co-insurance, for skilled nursing is $0 for 1 through 20 days, $157.50 per day, 21 through 100. All cost for days after 100. Now, for inpatient hospital stay, after the 150th day, that you go into your lifetime reserve days, and then you have all costs. So there is a sheet that tells all about the Part A deductibles, Part B deductibles, in the right-hand side of your folder. I have to remember because there's a certain amount of days for everything. Any other questions?
Observation days in the hospital do not count for that 3 days you go into skilled
No,
nursing.
ma'am.
Okay.
If you do go into the hospital, the first question you need to ask a social worker is, are you inpatient or observation? And let me tell you, it'll take you many tries to get that answered. Took me 2 days to find out if my grandma went into the hospital if she was inpatient or observation. And I asked every social worker there was. And so, because you can be in observation for 3 days, most people are not going in as inpatient. So that's the first, and that's, if you're inpatient, you have Part A, you have that $1,260 deductible for a benefit period, which is 60 days, but if you're Part B, you pay 20%. So,
You don't want to go in under observation?
not if you think you're gonna go to skilled nursing.
You might not have any choice. It's
Yeah.
how it's
how it's
your
coded, yeah.
disease is coded.
How you're, what is
How
it?
the doctor codes
Codes.
why you're there.
Okay, so
it's
you
all
ask
up
them
to-
immediately, am I observation or not?
That's what I tell everybody to do. And like I said, it's not an easy thing to find out. Because, I mean, my grandmother had been in the emergency room, we had been in another room, and like I said, finally on the second day, my mom, she said, I can't get in the answer, and I finally told them, I was like, you have to tell me. So, they did. I mean, it took a while, but yes. If you think you might need skilled nursing, you have to be an inpatient. For original Medicare Advantage is a totally different thing. But if you think you have, and I will let you know that I take appointments all the time. I'm here in Cookeville. I'm at the Upper Cumberland Development District and with the Area Agency on Aging and Disability. So a lot of people have specific questions to their needs. I'll be happy to sit down with anybody and answer them. I'm trying to do just a general overview right now, and sometimes it's very hard because everybody has a specific path that they need to go to. Any other questions before I go? Like I said, Part B enrollment, if you're on disability, you have to be on disability for 24 consecutive months before your Medicare will start. They might backdate it, but they have to say you'll be on disability for 24 months. They will automatically send you a Medicare card. I also was talking about being able to delay Part B if you have health employer coverage. And it all depends on how the employer union coverage works with Medicare. Some coverage, they'll kick you off when you turn 65 and you have to go on Medicare, others won't. So it really depends on individual insurance. So one of the things I always tell people before they come to me is ask your human resource person at your office to see how your insurance works with Medicare. As most of you know, there's a Part B premium. It's $104.90 a month. That it will be taken out of your Social Security check or your railroad retirement. If you are not receiving those benefits yet because you delayed your Social Security until your full retirement age, you'll pay that Part B premium quarterly. For some people who have a higher income limit, they will probably have a higher Part B premium as well. So again, Social Security can only tell you that. We can sort of figure it out, but they go by your tax returns from 2 years ago. Like I was saying, Part B your Part B services are your medical services, doctor services, Outpatient medical supplies, outpatient services, like if you go in for, trying to think of a surgery that's outpatient.
Everything is anymore.
Well, yes, very, very true. I was thinking of like an outpatient surgical center, that you might have something done there. Diagnostic tests, we were talking about some outpatient therapies, preventive services, flu shots are under Part B, so are pneumonia vaccines. Your yearly, wellness visit. After you've been on Medicare for 12 months, you're able to have a wellness visit with your doctor. That's a Part B service. Durable medical equipment, walkers, hospital beds. And as I was saying earlier, Medicare only covers 80%, Part B 80%. So you would be responsible for the 20% co-insurance. There are Medigap policies or supplement policies, which I'll go into just in a little while, that can supplement your Medicare, and depending on the plan, might pay all of the 20%. If you have hospital outpatient services, you have to make sure that your doctor that you go to, I think every hospital except the Mayo Clinic takes Medicare, so don't really, unless you go there, they do in some instances, but most of the time they don't. But just make sure your doctor takes Medicare assignment, or you will be charged the whole 100%. Most all doctors do. There's a few that don't. I'll go into prescription. I'm always afraid I'm going to run out of time, so I'm sorry I'm talking so fast. Part D prescription drug coverage, like I was saying, available for all people with Medicare. You don't have to have A and B. You can have A or B. So anybody that's eligible for Part A or B is eligible for a Part D prescription drug plan. They have to enroll in their plan. They have 3 months before they turn 65, the month of, or 3 months after. After that 7-month window, either with getting disability or getting Medicare through a disability or aging into Medicare, they will be assessed a penalty if they don't take a plan during that time, if they want to pick up a plan at another time. So they would have a penalty. The penalty is 33 cents a month for every month you were eligible for Part D that didn't take it. So if you were eligible for Medicare in February, you would have November, December, January, the month of February, March, April, and May, and you said, well, I'm just going to wait till January to pick up a Part D plan, you would be assessed a penalty from June through the end of December. You can look at the plans from October 15th through December the 7th to enroll in that plan, for that plan to start January 1st. All drug plans have to offer a minimum standard benefit. There's 30 drug plans for the state of Tennessee. Premiums for every plan, costs are going to vary. They start at $15.60 for 2015, and I believe go up to $122. Depending on what medicines you take and what pharmacy you use will determine what plan that would be best for you. So it's always good to, I guess, comparison shop. That's what most of the people think that SHIP does, is help with their Part D plans. We use Medicare.gov, and if you're internet savvy, you can go on that website as well and enter your medications in your pharmacy, and it'll give you the most cost-effective plans for you. Some plans do have an annual deductible, and that can be no more than $320 for the year 2015. We don't know what 2016 plans are going to be. They don't come out until October 1st. So, some plans will have co-payments or insurance on medicines. Some won't. Just depends on the medicines that you take and the plan that you pick of what your out-of-pocket expenses are going to be. Everybody will, if they take or spend out-of-pocket between the plan and yourself, when you reach $2,970, that's when you'll hit the coverage gap. So you pay 45% of the brand name medicine and 67%, I think 65 or 67% of generic, the full cost of the generic. After yourself, they take out what the plan pays, and after you only pay $4,750, a small price, that's when you get the catastrophic coverage, and you would just pay a very small amount. So if you take a lot of brand name medicines, you'll hit the coverage gap probably mid-year. You take a lot of cheaper generic medicines, typically you don't get the coverage gap. There is another pamphlet in your folder that does talk about the donut hole and coverage gap for 2015 in your folder as well. The initial enrollment period for Part D is the same as Part B, 3 months before, the month of, and 3 months after. Now, the lady right there in the stripe, she was asking about the annual election period. That is October 15th through December the 7th of every year. You can switch, drop, or add prescription drug coverage at that time. If you're not on a plan and you want to be on a plan, that is the time of year to start looking at the plans. You can enroll during that time. Your plan would start January 1st. If you have a plan and you're not happy with it, you can look at the other plans and enroll in a different plan. We encourage everybody that's on a Part D plan to look at their plans every year during that time, because the plan that you're on now, they might change your monthly premium. They might change the formulary for what medicines they cover. They might change the copays. They might even add a deductible. So we always encourage people to look at their plans during that time, so they're still going to have the best plan for them next year. Just a side note, we helped about 2,000 people in the Upper Cumberland area last year during those 7 weeks. So, talk about Part C a little. Most people know it as Medicare Advantage plans. I was telling you, not all doctors, not all hospitals, not all providers take these plans. I will tell you, if you're a traveler, you travel to see your grandchildren in a different state, or you like to travel across the country, Advantage plans might not be the way to go. All hospitals have to take you during an emergency, but once they're able to transport you to another hospital, they will. So they don't want those out-of-pocket costs, as well as you don't want those out-of-pocket costs. Now, private, you have to have Part A and Part B to have an Advantage plan. It's not secondary coverage insurance. It takes you off your you still have your Medicare benefits and protections and concerns, but what it does, it puts you on a privatized plan. And they have in-network providers, out-of-network providers, and some providers don't take that plan at all. So you would have to pay, if they don't take that plan, you would have to pay the full cost. There's always going to be copays for doctor's visits, hospital visits, typically a lot of tests. Just like Part B is going to be 20% out of pocket. They might not have a monthly premium. Some do, some don't. But the big thing to know, you have to do a lot of research with the Advantage plans to make sure all of the hospitals, any provider, anywhere you go, is going to take that plan. And they're, like I said, they're just basically county to county. So if somebody lives in Putnam County and they move to Van Buren County, they might not have that plan offered in Van Buren County. So they would have to either switch to another Advantage plan, or they can switch back to traditional Medicare. You would get all of your Medicare covered services through those Advantage plans. Some plans do cover things that original Medicare does not, which would be dental, vision, and hearing. But you have to make sure you go to a doctor that covers that, or that takes assignment for that plan. But you have to look to see for what that plan. They might only give you $100 worth of vision. So sometimes it might not be worth it for $100 worth of vision coverage to go on that plan if that's all you're looking for. I have known people that just got a standalone dental or vision plan that was a lot cheaper. They could go to pretty much any eye doctor or dentist that they needed to go to and, stayed on traditional Medicare because the Medicare Advantage plan wasn't covering enough of what they wanted. Typically, they'll say they'll cover all 100% of Medicare covered dental services. Well, Medicare doesn't cover any dental services, so it's great that it says 100%, but if Medicare doesn't cover it, you're still having to pay the full price.
Is Medicare accepted in all 50 states? And is it accepted anywhere if you have an emergency and you're out of the country?
If you are traveling to Alaska and driving through Canada, you can be covered, but typically it's not. It might be covered under, like, close to the Canadian border, in the United States border, because you're either traveling or you're very close by. But typically, if you're going out of the country and traveling somewhere else, we suggest you buy travel insurance.
And
Yes.
there's certain Medicare supplement plans that have foreign travel.
But Medicare has to pay
If you're
first.
between Washington and Alaska and you're in Canada, there'll be a $200 deductible that will cover up to $50,000.
Some do, but typically your Medicare,
There's only two different of the Medicare plans that do.
yes, but Medicare has to cover first for your supplements.
Yeah,
So,
but if it doesn't, these are part of Medicare, those two particular Medicare supplement plans.
so, I mean, you just sort of have to take a gamble if what Medicare's gonna cover and what it's not, but
Just buy
if you're
travel
traveling,
insurance and forget it.
if you're traveling, Canada, you're safe if you're going to certain places, but if you're going across the pond to Europe, it's nothing, you're gonna have to, get travel insurance. Medicare is just not gonna cover it. So, like I said, they do have a couple of supplements, but again, it's one of those, you have to see what you're gonna need and do your homework to see if that's gonna be best for you. So, if you're only gonna go on one trip, then, and you're not gonna be traveling continuously, that might not be the best option. If you are gonna be in the US most of the time, but again, there are certain things, I haven't got to Medicare supplements yet, so, but they're due, and they, you just have to know Medicare just doesn't cover foreign travel very well, if at all. So, we have a lot of people try to help them. We have a lot of people call that try to get us to help them get Medicare covered for services, in Europe because they've had a heart attack or they've had something, go wrong while they're there, and unfortunately, we don't have those options. So. Medigap policies and Medicare supplement policies, people call, they're sort of an interchangeable word. They are, what we say, they supplement your Medicare or they fill in the gap for Medicare. Like I was saying, Medicare only covers 80%. There's also a Part A deductible. Private insurance agents will sell Medicare supplements. We always tell people to start local, talking with their agents, because a lot of times you get that one-on-one personal service. You can talk about the different plans. They're all lettered, unfortunately. There's A, B, C, D, F, G, N, M, and N, I believe. So the most common supplements that people tell us that they buy in our area are C, D, F, G, and N. All supplements, whether you look at D with 4 different companies, are going to be the same. The only thing that's going to be different is the premiums. So we tell people to talk to 3 different companies to see what their premiums might be. They can go up 2 times a year. They can go up for your age. Typically, they always will. And they can go up for inflation. So and we always tell people to ask what their rate of increase is over 5 years. They can sort of tell you how much they raise their premiums, and you can see if it's, some might raise them more, some might raise them less. So if you can typically get a general idea over 5 years. They have to be licensed by the state. You can go on the Department of Commerce and Insurance website and get a copy of all insurance companies that are sold in the state of Tennessee. You're more than welcome to call me and I'll be happy to mail you one. We have copies in our office. They're gonna have monthly premiums according to the plan. Like I said, they're standardized by letters, so, it's a whole bunch of alphabet soup when you have Part A and Part B and Part D, and then all the letters for your supplement policies. Typically, the best time to get a supplement is in the first 6 months that you get Part B. After your 6 months, they can deny you based on health questions. Can have a higher premium based on those health questions. They can have medical underwriting. So in that first 6 months, they can't deny you based on medical underwriting. They can't deny you based on any health concerns. So if you, typically we say you're married to, because once you get a supplement, you can change your policies. Sometimes it's a little harder to do if you have any health concerns or medicines that you take. So the first 6 months is the best time to get them. If you are disabled or you're under 65, you're able to get a supplement policy as well. That started a couple of years ago for the state, but I will tell you they're typically 3 to 4 times higher than when you turn 65. Not impossible to get them, they're just more expensive. They don't cover prescription drug. They don't cover prescription drug plans or prescription drugs. That's why you need a separate prescription drug plan. If you work for the state, I know I've talked to several people that work with the state and in some shape of capacity or form of capacity. You might be eligible to receive the Tennessee plan or the POMCO plan, which is a supplemental policy to go with Medicare. Depending on how many years you worked with the state, you might get a lower premium. I know if you work 30 plus years, your premium would be, for a supplement, would be $86.38, I believe, or $86.83, I can't remember. And then if you have 25 to 30 years, 19 to 24, and then under 10 or under 15. So your spouse, if they're have turned 65, then they might be eligible as well. The POMCO State of Tennessee plan doesn't inflate with age, so it's a typically more flat premium. You can talk, if you are with a state employee, you can talk to the benefits department and they'll be happy to help you. Or you can call me and I'll be happy to send you some more information. Any questions? I know I'm going through this really fast and I apologize. Am I okay on time? Okay. So, I will tell you that there's the SHIP program, all 50 states and the territories. We have been around, I think, 20 years, but most people know us for open enrollment. We're a volunteer-based program. I got to put a plug out for our volunteers. We only have 2 staff members for 14 counties. Like Holly said, I'm the program manager, and Fran Davis is our volunteer coordinator and benefits outreach coordinator. So if you do call that toll-free hotline, I am not going to be answering the phone when you call. Please leave a message, and I'll get back. Right now, our callback time is about 5 days. During open enrollment, it can at least be a week. Most of the time, it's 2 or 3 days. I was on vacation for part of last week and part of this week, so that's why I'm a little behind. So, but like I said, we have volunteers that help as well in a lot of our counties. So if you know someone or if you would like to be a volunteer, we'll be happy to train you. We sort of tailor the program to what the volunteers' needs and concerns are, because not everybody wants to do the same thing. So I like to tailor the program to them and what they like to do. On the last page, I put more information. It has our toll-free hotline. If you suspect Medicare fraud, waste, and abuse, our agency holds the grant for the state of Tennessee for SMP, the Senior Medicare Patrol. So Lonnie Holloway Hitchcock's phone number is on there as well. It's a toll-free number. It rings directly into her office. She can help you with any, if you suspect fraud or if you suspect anything that might classify as fraud, waste, or abuse, such as overbilling or maybe billing for services that you didn't get. Please always check your Medicare summary notice. It'll always tell you what has been billed under your Medicare number. Keep it, it's, you know, I think they do it once once a quarter. But, please check that with the services that you got to make sure that nobody has gotten your Medicare number, and tried to use it somewhere else. Or, you know, it might be a coding error. They might have typed in something wrong and you didn't get that service, you got something else. My email address is on there as well. That toll-free number rings directly into my office. So, like I said, just leave a message because I'm typically on the phone all day. So, I'm sorry I rushed through this. Like I said, I'll be happy if you have any groups, companies, church outings, or you need somebody for a guest speaker. I'll be happy to come to your event. We'll be happy to help you in any way we can with Medicare questions and concerns. So I'm sorry I had to rush through it. Like I said, typically it takes me a couple of hours, so.
It's a lot of information for 45 minutes.
Yes, it is.
Any last questions for Kelly before we close?
Yes.
Session?
You said the coverage or the varies county by county?
Mm-hmm. The
How
Advantage
about
plans.
state by state? If you enroll in, say, another state, if you,
For Advantage plans or
Yeah.
supplements.
any,
Okay, well, Medicare's good everywhere. If you have a supplement, typically it'll move with you.
okay.
If you go to Hawaii, for the most part, unless you're with Tennessee Farm Bureau, the Tennessee Rural Health, I don't think it'll move, just because you have to be a resident of Tennessee. But that's the only one that I can think of. But I would always check, if you do move to another state with your supplement company, to make sure it's going to be still good in that state, because your Medicare's primary and they're just paying secondary. Now, with Medicare Advantage plans, I mean, it's a county to county thing, so, but yes.
Any other questions? Okay, please join me in thanking Kelly for this information. Thank you, Kelly.